Good evening, everyone. We're so excited for you to be here. My name is Jacquelyn Martell, and I humbly serve as the Director of Advocacy for Achievement First Public Charter Schools. It's an honor to be here this evening amongst such wonderful parents, advocates, community leaders, and our esteemed speakers. The event is in partnership with the New York Charter Schools Association, and we also realize that we have other schools from across New York State on this call, so we're very excited for everyone to be here this evening. This event is the second part, of our vaccination informational forum in January. For those who joined us, we realized that there was much more information that we needed to cover, and there's been much more information that has come out since January. So we wanted to have this forum to continue the conversation and as well as to give updated information regarding the COVID-19 vaccine and so on. So I want to thank everyone for being here. We have families and parents from across the state, and we're just so happy to be able to have a conversation around the vaccine, the science behind it, the rollout on the city and state levels, and the differences between the vaccine, variants, access, and much more. Before we start, we want to get a feel of the room. So we're going to launch a poll question. We want to see who on this call has gotten the vaccine. And if you plan to get the vaccine. So if we could launch the poll question. All right. Thank you so much for providing that info. We'll be able to talk more about the vaccination at large and answer any questions around hesitancy and the science behind it, as I mentioned before. So for the first part of this webinar, we will hear from our esteemed elected official on the call, Assemblywoman Alicia Hyndman of the 29th Assembly District in Queens. We want to thank you so much, Assemblywoman Hyndman, for being here this evening, as well as our amazing health leaders and advocates. Assembly Member Hyndman, thank you so much for your advocacy, your leadership in Albany, and taking the time during a busy legislative session to be here this evening. So welcome, and the floor is yours, Assemblywoman Hyndman. Oh, you're on mute.
I should be a wizard at this now, but can you hear me now?
Yes.
Okay, good. So I just want to thank, see, now I lost my notes. I'm sorry. I had the vaccination today, everyone. So just bear with me. I'm gonna use that for the next 24 hours.
Yeah.
I want to thank the New York Charter Schools Association and Achievement First Advocacy New York for having me. And I think this COVID vaccination, if anything, the conversation should not stop, should definitely continue, because the Speaker of the New York State Assembly, Carl Hastie, who had the first dose of the vaccination, I believe he had, I'm not sure if it's Pfizer or Moderna, he has now tested positive for COVID. Another colleague, Ron Kim from Flushing, Queens, he has COVID. Another member of EDRA, who represents an area in Nassau County, he has COVID. And Ed Ra was in the assembly last week. Fortunately, I wasn't in Albany last week, but he definitely was. So as we know, people are still testing positive, people are still dying, and I'm really concerned for communities of color that where we have made the vaccination available, people are not always taking advantage. So today I got the Johnson & Johnson vaccine in the assembly, the well of the legislative office building. And with all my apprehension, I took the vaccine. I feel okay. I'm just a little more tired than usual, but I think there's hesitancy in the community around New York City and around New York State to get the vaccination. And as our children in traditional public schools now have the option to return to schools, I also wonder about the professionals in the building. Are they getting the vaccinations? Are they making themselves available? Are they using health and hospitals? Are they using the New York State website? Are they checking with their pharmacists? Are they checking with a lot of churches have been given the vaccination? And we know how COVID-19 hit us hard, especially in communities of color, how it's still an issue, how access to good healthcare has been an issue for years. And this pandemic certainly highlighted that in communities around the state. And the rollout has been bumpy, has been very, very slow. But now I feel like there are more opportunities. I do get calls from individuals, especially our senior citizens, who are looking for places to take the vaccine that are closer to home. And for one site that the York College, which is part of CUNY site in Queens, New York, we're giving 3,000 vaccinations a day. The individuals that got it first are now on their second dose. So now that site is backed up. But I am optimistic, as I always will be, that our community will get the vaccine. I know there's some hesitancy. I know I know in the past that there have been wrongs towards communities of color. But when I tell you that my mother, who's an RN and who has been an RN for over 40 years, said to me, you know, she's getting the vaccine, my father's getting the vaccine, that I should get the vaccine, that did it for me, because she knows her history. She understands how important it is vaccinations to prevent diseases over the years and how important this is for us moving forward. So I want to thank you all. I will stay here if there are any questions for me later on, but I really want to thank my good friend Yomika Bennett for inviting me. And I'm so excited for your leadership in this sector, really raising the level of awareness of education on all levels for all of our children. And thank you very much.
Thank you, member. It's a pleasure to have you, and I'm glad you're able to stay. And I'm very happy you had that vaccine today. Wish you all the best on that, and thank you for being the outstanding spokesperson for that tonight, especially. Thank you. Really appreciate that.
So I want to turn it over now. I want to thank you also, Assemblywoman Hyndman, who also, I follow your Instagram. I'm like an Insta fan and your Twitter. I'm not a stalker. I'm just, you know, a fan. But no, in all seriousness, really appreciate the work that you've been doing in Queens, specifically on vaccination access for your constituents, but also within the state at large. And I think it's important for us to continue these conversations, particularly as we talk about, you know, marginalized communities who have had where there is a history of systemic injustice within our healthcare system. And I think it's worth having conversations such as these that showcase the importance of just being able to have space to talk about this, but also to, you know, ultimately advocate for more access for the vaccine, but also better access within our healthcare systems at large. So thank you also for advocating in that regard as well. I'm going to turn it, and I saw someone just threw in the chat that they got their second dose. So kudos to you, Leslie. I got my second dose of Moderna last week, but we all know that it is a personal choice. And so we want to hold this space to answer any questions that you might have about the vaccine. And the science behind it, how you can get access to it, how you can still help to stop the spread when you have the vaccine, and what ways we can work together to mitigate the spread of COVID-19. So I'm going to turn it over to Yomika. Assemblywoman Hyndman gave a great intro of Yomika, but she is my partner in crime. And she serves as the executive director of the New York Charter Schools Association. And she will be leading the conversation with our wonderful health experts. So I'm going to turn it over to you, Yomika.
All right, great. Thank you, Jackie. So I want to start out by thanking everybody who's here tonight. I know there are many people who registered and are not able to make it. We are recording that. I want to make sure that everyone's aware of that. So this will live and be available for people. Please share the information you hear tonight. This is our second time doing this. It was powerful the first time. We had an overwhelming response and request for another one. We're back here today. Look for this recording, share it with people, spread the word, get good information out there about the COVID-19 virus and especially about the vaccine. All right, having said all that, we have some powerful women in the house. I want people to take a moment. I want to say Happy Women's History Month, and I want to give a shout out to all the phenomenal and powerful women that you see on the screen today and who are going to here with us today as well to share valuable, accurate information. And without further ado, let me please introduce Dr. Lekeyah Wilson from Rochester Regional Health, Wilma Alvarado-Little, Associate Commissioner, Director of the New York State Office of Minority Health and Health Disparities, Dr. Lina Finlan, I apologize, that's from St. Peter's Hospital in Albany, New York. All right, we had representatives lined up from New York City Health and Hospitals, but they will not be with us tonight. But as I said, it is Women's History Month. We have all the women in the house who can provide the information, and this is how we do it. We show honor and support for this great month. Happy Women's History Month, and we're going to cover, as I said, COVID-19, providing important information, potentially life-saving information. And so without further ado, we will hear from these esteemed panelists. I'm going to open up first with a question. And I want to make note that we intended to have interpretation services for tonight. Our interpreter has not made it yet to the webinar, so as soon as she does, we will have that service provided. Some of the panelists have offered, at least one has offered to speak in both English and Spanish, so we will be pausing throughout to allow for folks to hear the same information in Spanish where it's available. Okay, so without further ado, again, I keep saying that, New York State has announced this week that individuals 50 and over, 50 plus, can receive the vaccine. So we're moving in a direction where more and more people are included. People are shopping in some cases, the type of vaccine, trying to get a specific type of vaccine. And we know what's out there, the Moderna, the Pfizer, the Johnson & Johnson. Is that a good idea? So I want to put this out and ask the expert, is that a good idea? Should people be shopping for a vaccine? And if you can, is there can you explain the differences for their vaccine? Should they be shopping? What do you say on that? And I just will ask the panelists, just jump in, unmute yourselves. We'll have a conversation as if we are really in person and let it flow.
I'll jump in. So in answer to your first question, in general, the answer is no. All three vaccines that are out, they offer high protection against hospitalization, severe disease, death from COVID-19. If you have a fear of needles, if you think you're not going to be able to get back for a second shot, or maybe the place that the vaccine is being given is not accessible to you, those are reasons to maybe consider the Johnson & Johnson vaccine. But in general, they're all very, very efficacious for severe disease, hospitalization, and death. Y lo diré en español. La pregunta fue si es buena idea buscar una de los tres tipos de vacuna, y la respuesta que dijo es en general no. Todas las vacunas ofrecen un alto nivel de protección contra hospitalizaciones, un COVID severo o la muerte de la COVID. Si usted es una persona que tiene miedo a las agujas, o tal vez va a ser difícil regresar para la segunda dosis, o es un lugar que es difícil llegar a, en ese caso puede considerar el Johnson, que es la vacuna con un dosis nomás.
And I can add to that. So we know that there's more allocations of vaccines in New York State, but we have to do what's available, signing up for scheduled appointments, whether that's Pfizer, Moderna, or Johnson & Johnson. The other question is, what is the difference between these three types that are available for us right now? So two of those vaccines are mRNA vaccines, and one is a viral vector vaccine. And what does that mean? So there's a lot of misconceptions that the mRNA vaccine can alter our DNA, and that is not true. With the injection, the way that it works with the Moderna and Pfizer, they have a protein that will contain the messenger RNA, that is injected into our body. And then the cells in our body take that mRNA and convert that to a protein, the spiked protein that is on the outside capsule of the COVID-19 vaccine virus. Our body recognizes that as a foreign protein, and we develop antibodies towards it. And that is how we fight off infections if we were exposed to COVID after our vaccination. When you talk about the Johnson & Johnson, that is a viral vector vaccine, which means they take a weakened virus that we're already exposed to. So for example, adenovirus is the virus that they use, which causes the common cold. They weaken it so that it can't cause any type of illness. Then they put in the protein that we want, so the spike protein on the outside of the coronavirus, inside of that vector. They inject that into our body. That then produces that spike protein, and our body recognizes that again as foreign, and we develop antibodies to fight off the infection. So those are the two differences. They're both all three of them are highly effective. We should be very proud of technology now, because these vaccines are way better than many of the vaccines that we've had in the past.
Thank you. Wilma, I want to give you the opportunity to add anything to that.
Oh, thank you. Yeah. As the non-physician in the group, I'll lend my perspective in that way. And, you know, from a community engagement lens, we waited so long for a vaccine, and now we have 3. And I think that's truly a blessing. So again, no one is saying you have to do this one, you have to do that one. No, as you know, the 2 clinicians here have shared that there is availability of the 3, and it's it could be a personal circumstance. What does your schedule allow? Do you have the ability to travel? Do you, is this, you know yourself the best. As Dr. Finlan said, if you have, a shyness to needles, then Johnson & Johnson would be that one, right? So, again, we went from no vaccine to now having the option of 3. So that truly is a blessing. And then asking folks about, where can they sign up? What's the availability? That is another piece to it. However, also, the information is there and it's available. So one of the 3, will be beneficial for the reasons that have been mentioned. And I'll just say it very quickly in Spanish. Entonces, la pregunta es si, como dijo la doctora Finlan, ¿qué es la situación acerca de si uno va a tomar una vacuna sobre la otra? Entonces, mi respuesta es simplemente que nosotros antes ni teníamos nada de vacuna, ¿verdad? No había nada de vacuna y ahora tenemos 3. Y eso sí es una bendición. Entonces, nosotros podemos escoger, por ejemplo, como dijo la doctora, si uno tiene un miedo a las agujas o, por ejemplo, según el horario, no pueda asistir a la segunda dosis. Entonces, la vacuna que es de solamente una dosis sería bien. Pero ahorita sí tenemos mucha información sobre las 3. Las 3 vacunas tienen efecto y también hay mucha información sobre estas. Y también empezamos de 0, nada de vacuna, y ahora tenemos la oportunidad de elegir una de las 3. Entonces, infórmense y entonces decidan cuál será la mejor para usted y su horario y su salud.
Great, thank you. And so I'm just going to make sure I heard what I heard. So I heard that the vaccines will teach our bodies how to fight the vaccine, or how to fight the virus should it come. And that if we get vaccinated, our bodies will be ready, right? So we right, and so the old adage that, right, if you stay ready, we don't have to get ready, right? That's right. Mm-hmm. So with the vaccines, we will stay ready. We don't have to get ready. When that virus comes, if that virus comes, we would be ready if we're vaccinated. And that does not, as despite what Facebook and Instagram have said, right, or Facebook and Snapchat and everything else has said, and Twitter, it does not affect we will not change our DNA. Am I right about that? All right, thank you. Cleared up a lot of misconceptions. I can get back on social media and fight back right now. Okay, second question. Can children and students get the vaccine? So we're 50 plus, we're working our way down. Are we working our way down to students in schools and children?
Not quite yet.
Yeah, I was
we
going to
touched
say,
on it
no,
last
we're
time.
not there yet.
Cleaning up. They're in the works. Pfizer's completed enrollment for 12 to 15, and Moderna's recruiting for the younger ages, but we're not there yet. La pregunta fue si los estudiantes y los niños pueden ser vacunados, y todavía no. Es solamente si está mayor de 15 años con el Pfizer. Pfizer sí ha completado la inscripción para su ensayo clínico de niños 12 a 15, y esperamos que tenemos los resultados este verano, y Moderna tiene ensayos para grupos de niños menores todavía, pero lo tenemos para los niños pequeños todavía.
Yeah, and I would agree with what was just said, that that we're not there yet, that it's in the works, and I just want to be clear that because there is research and or studies being done with that age group, it doesn't mean that the vaccine is available this hot second, right? We're not there yet, and so because sometimes we hear numbers and we're like, I thought I heard that they said yeah, and it's like no, the studies are being done. However, the availability of the vaccine itself, not yet. Entonces, solo estaba explicando que estaba de acuerdo con la doctora, que uno escucha a veces una numeración, pero ahorita lo que está explicando la doctora es que las compañías para las vacunas están haciendo las investigaciones con estas edades. No es decir que la vacuna ahorita mismo esté lista. Esas son dos cosas distintas.
Dr. Wilson, before we move on, do you want to add anything?
Well, absolutely. So yes, the trials are on their way. We are excited and anticipating what the results will show. I think it will be a very safe for our kids. And I, for one, will have my kids signed up as soon as it's available.
All right. Okay, so as more people get vaccinated, restrictions are being lifted, and people are venturing out more, right? Especially in the good weather. The sun is coming out now. We've been home for a long time, right? What types of preventative measures should be taken to ensure we help stop the spread, even for people who are vaccinated? Is that a thing, or can I just go outside and run around freely and enjoy the sun at last?
I think I was looking at some statistics this week that we're at 30% in New York State, or maybe it was Monroe County, that are at least have the first dose of their vaccination. With that being said, we are not up to the percentage we need to say that we can run freely without masks and without socially distancing. We still need to know if these vaccines prevent transmission from one to another. What we do know is they prevent serious disease, right? So they prevent mortality, hospitalization, and what have you. Could you still have mild symptoms? Possibly, we're not sure. So then the recommendations should still be the same as if you were not vaccinated, that you should still be wearing your mask. You should still be social distancing. You should still be washing your hands and being mindful where you're at. I know that the CDC has put out new recommendations where that if you're fully vaccinated, that you can be in settings with other adults that are fully vaccinated, or if you're going to be inside with other adults, making sure that you're still wearing your mask and then you're still socially distancing.
Yeah, I agree 100% with what Dr. Wilson said, especially because if you read those CDC guidelines, they are very specific with who you can go indoors with, and they should be completely vaccinated, all the other adults. And if you are indoors with someone who is unvaccinated, it is only recommended in a very specific situation where that person is at low risk for COVID, and it's one household by itself. So if you're in a household with another person that, if they are at high risk for COVID, or someone from their household is at high risk for COVID, you should not be unmasked. You should not be close, physically close. So it's a very narrow window that the CDC gives you, and it's almost better to just think of it as things should stay how they were before. I'm going to say a little bit about what Dr. Wilson said in Spanish, and then kind of my addition. So, la pregunta fue, ahora que más gente están vacunado, ¿qué puedo hacer? ¿Puedo salir sin mascarilla por todas partes o tengo que quedar lo mismo, con mascarilla, con distancia social? Y la doctora Wilson y yo creo que estamos de acuerdo que la cosa mejor hacer es quedarse lo mismo, continuando con las mascarillas, continuando con la distancia social, lavando las manos, porque todavía no sabemos si las vacunas previenen transmitir asintomáticamente el virus. Sabemos que previenen el COVID severo, pero todavía puede tener síntomas menores y tal vez transmitirlos sin saberlo. Esos detalles no sabemos de las investigaciones todavía. Y el CDC sí ha salido con nuevas recomendaciones con cambio que puedes hacer si está completamente vacunado. Dicen que unos adultos vacunados pueden estar adentro con otros adultos vacunados sin mascarillas, pero hay restricciones en sus recomendaciones. Si está adentro con una persona que no está vacunado, tiene que estar una persona que su riesgo para contraer el COVID severo es bajo. No puede ser una persona con una condición médica que le pone a alto riesgo del COVID severo, o que esa persona vive con otra persona que está a alto riesgo de contraer el COVID severo. Entonces, por lo menos es casi mejor pensar hacer lo mismo, continuar la distancia social, continuar con las mascarillas, continuar con lavando las manos hasta que sabemos más sobre todo el COVID y las vacunas.
All right, thank you. Wilma, I want to give you the opportunity to add anything. I want to make sure everybody gets a spot before we move on to other questions.
No, I completely agree with Drs. Wilson and Finlan. You know, this is a weapon in our arsenal. This is not, the end all be all. We're making progress, and as the doctors have said, we still need to be mindful and careful, because some of us may have been vaccinated. It doesn't mean that, we don't have to be mindful about the potential of putting others at risk. We don't know that yet. We remain hopeful. However, the guidelines are still there. The precautions are still there. We need to still practice, as the doctors have said, social distancing, hand washing, wearing our masks, and being careful as best we can, because it's not all about just us. It's those around us in our communities, where we interact. So I'll just say that very quickly. Entonces la pregunta fue ¿qué pensaba yo sobre lo que acaban de explicar las doctoras? Y yo dije que estoy de acuerdo, que todavía esto no se ha terminado, ¿verdad? Todavía tenemos los riesgos, todavía es de utilizar las mascarillas, la distancia social, lavándose las manos, todo eso, porque, y también estar consciente de que aunque a nosotros hayamos ya estado vacunados, no es decir que Dios guarde le vayamos a pasar algo a otra persona. Tenemos que estar conscientes de nuestras acciones también, porque no solamente se trata de nosotros, pero de nuestra comunidad también.
All right. So far, we've talked about the fact that what the vaccine does, how it works, in preparing us for the fight. One question I didn't ask outright is it safe? Can you talk a little bit about the safety? What are the risks? What should people expect to experience, if anything, once they get the vaccine? Can you speak to a little bit about that? And Assemblymember Hyndman, I know you're resting, but if you're able, if you want to chime in as well and talk about what you're experiencing now, that you're welcome to do that too. But we'll always start with what I look at on my screen, and so I see Dr. Finlan first, and then I see Dr. Wilson, and then I see Ms. Alvarado-Little, and then the Assembly member, if you're again available to come back on and speak to that, you're quite welcome.
So yes, they are safe, and very short answer. To expand on that a little bit, there's a lot of safety and monitoring that's done as these trials go on to kind of check at multiple points. There's not just the company that checks the safety. It's not just the FDA that checks the safety. They both have committees that are actually members are secret so that they can't have corporate or governmental pressure. It's called the Data and Safety Monitoring Board. It's independent. And then, New York State also has an independent advisory board that has independently looked at the data after the FDA gives their authorization and has said okay to all these 3 vaccines we have as well. So I'll say it in Spanish. La pregunta fue si la vacuna es seguro. Y sí, todas las 3 están. Hay los datos primero se llegan a un tablero independiente que evalúa las investigaciones. Los miembros de ese tablero son un secreto para que el gobierno o la empresa no le puede influenciar. También hay otro tablero del FDA que evalúa los datos. Y después de eso, si pasen a esos 2 tableros, el estado de Nueva York también tiene un grupo que evalúa y decide si está seguro, y ha dicho que sí son las 3 vacunas que tenemos.
Yes, I agree with Dr. Finlan. Yes, these vaccines are very safe. We monitored them very closely. They were thoroughly tested before the FDA approved for emergency use here in the United States. One of the things that I also want to dispel, one of the myths of like, okay, some of these vaccines contain messenger mRNA, and what happens in our body when that's injected, that degrades. It's gone within a couple of days. So it's not like permanently there in your body. The proteins that they're producing, your body develops the antibodies for that. As far as what to expect when you get your vaccine, it's very common to have soreness at the injection site, like many vaccines. I felt like my vaccine personally was kind of like a super tetanus shot, because you have some of that soreness after those type of injections, and my soreness lasted 24 to 36 hours. I had very vague headaches. Other than that, I still was able to go to work. I was preparing to take the day off, but I was able to go to work the next day. As far as some of my colleagues, their symptoms may have been a little bit worse, where they felt like they had the flu, or they felt like they had just full body aches, headaches worse than just a vague headache, more like migraines or what have you. And they were sick maybe 36, 48 hours, and then felt quite better afterwards. So your response can vary. Some may have no side effects at all, and some may have more severe, like, gosh, I think that was the flu. But this is also an indication that your body is responding to the vaccine. You're having an immunological response, meaning that it is working.
All right. Thank you, Dr. Wilson. Wilma, I want to give you the opportunity to comment if you'd like.
Sure. What I'd like to share are some fact sheets from the FDA about the three, Johnson & Johnson, Pfizer, and Moderna. So there's some information for our communities to look at in Spanish and English, and I'll try to get that into the chat, because it's really important to get the correct information that supports the science and the data, because there are the myth versus the fact, and the information is important for folks to make their decisions, right? You may not agree with me, however, this is the science behind it, and so I'm hoping not to test my technical skills here, so I'll try to get them. If not, I'll share with you all. Lo que estaba explicando es que aquí hay unas hojas informativas sobre de información sobre las 3 vacunas, y eso es algo muy importante para que las personas puedan leer y revisar la información, porque hay mucho cerca de los hechos y los mitos, y necesitamos saber lo que nos está diciendo la ciencia para poder hacer una decisión basada en información y no algo de que alguien haya dicho algo sin razón, y también en la ausencia de la ciencia. Entonces voy a tratar mis habilidades técnicas, y si no logro hacerlo, ponerlo en la cajita chat. Entonces se los voy a enviar a nuestras expertos aquí que saben más que yo. Gracias. Thank you.
Great. So thank you all. We have a number of questions lining up in the chat. I'm going to ask one more question, then we're going to go to the chat because we don't want to miss any of these questions. We want to make sure our attendees here tonight have their questions answered. But one question I have is, how long does the immunity from the vaccine last? And I'm going to combine that with a question about herd immunity and why that's important. If you could speak to a little bit of that. We'll go in reverse order this time, or reverse. We'll start with Dr. Lekeyah. Dr. Wilson, Dr. Wilson, Dr. Finlan, and then we'll close out with Ms. Alvarado-Little.
So how long does the immunity last with these vaccines? I think that has not been answered yet. We still need to know, so there's going to be a lot of research of seeing how long it lasts. There are thoughts that it will last for a while, and if there were other variants, that we would need a booster maybe sometime afterwards to deal with those new variants of the COVID vaccine. And as far as herd immunity, we need to get close to like 90% or more of individuals vaccinated to actually have that herd immunity. Thank you.
All right. Hi, Dr. Finlan. You can go right ahead.
Yeah, trying to figure out how to unmute myself. So agree with Dr. Wilson. We just don't know in terms of the immunity at this point. We don't know the immunity from how long it's lasting from vaccines. We don't really know how long it's lasting from people that actually got infected with COVID. And herd immunity, kind of to define it a little bit, it's basically what resists the spread of an infection through a population because of pre-existing immunity. And that pre-existing immunity can come from either people being vaccinated or people being infected. And ideally, we want it from people being vaccinated. And it's really important because if there's a significant immunity throughout the population, then the virus really can't spread. And there's a lot of unknowns in terms of when we might reach that for COVID-19. You know, we have the variants that Dr. Wilson mentioned. We also don't know how long the immunity lasts. So it may be that COVID becomes endemic like the flu, just hopefully not as scary because we decrease the hospitalizations, we decrease the deaths, and kind of goes on, we go on being able to live our lives. So, le voy a decir en español. So la pregunta fue, ¿desde cuándo, hasta cuándo tenemos inmunidad de COVID de las vacunas? Y bueno, hay dos preguntas, esa fue la primera. Y la respuesta es que no sabemos todavía, no sabemos cuánto dura la inmunidad de la vacuna, tampoco sabemos cuánto tiempo dura la inmunidad. Am I frozen? Okay.
No.
I'm on my screen, so I'll just keep talking.
Okay.
¿Cuánto dura la inmunidad de una persona que estaba infectado con COVID? Tampoco. Había una segunda pregunta que ¿qué es la inmunidad colectiva? Y la inmunidad colectiva es algo que es la resistencia de la propagación del virus o de cual enfermedad infecciosa entre una población está basado en una inmunidad preexistente que puede llegar de gente vacunada o puede llegar de gente que ha contagiado la enfermedad. Esperamos que llegue de vacunas. Para COVID no sabemos cuándo llegaremos a esta inmunidad colectiva porque hay los variantes y también no sabemos hasta cuánto tiempo dura la inmunidad. ¿Qué más dijo? Dr. Alvarado, or Ms. Did I say anything else?
I think you captured it. I think
Okay.
you captured it. Thank you. Yeah,
So,
and I agree with both the doctors here. I defer to them, and I take comfort in hearing that, you know, the honesty with which the information is presented, because, you know, we don't know. And so, you know, when you hear it from a provider, because saying I do not know is a very sophisticated response. And we need to understand that we're, you know, to a degree, we're all learning, some of us more than others. And that's why it's great to be able to defer to the experts to continue to learn. So I appreciate the opportunity.
Okay, thank you. I'm going to take one more question in there, and it's for you, Ms. Alvarado-Little, and it's really about sort of the public health communities of color really have been especially hit by COVID-19. And we talked about, and the Assembly member talked about the inequities, right? Jackie mentioned that as well, that happen in communities of color in terms of health and access to health services, et cetera. First, what can we do to improve sort of access and equity? What are the kind of things that you would recommend? What can we all do as neighbors, friends, families, people and organizations who can possibly talk to others in organizations, and questions including like undocumented people. Can they trust that they can successfully get the vaccine? And then, so from your work, from your perspective, can you just say a little bit about that?
Sure. Well, first, I think it's important that those whom we serve are heard. And many times, by role, there is a degree of not being comfortable with presenting any ideas, thoughts, or concerns, right? And I'll use my culture. In my culture, there's three people you never question, and that's the teacher, the doctor, and the priest, right? You never question them. It's like, yes, okay, this is what I'm going to do because the doctor told me this is what we're doing, right? And so we have to create that space to encourage the questions. And so, you know, we have an assembly member here who is a voice for their community, you know, who people trust and know that if they feel they are not able to present the concern at whatever level, they can go to the assembly member and be heard. And we really welcome that opportunity as well. So for example, the Office of Minority Health and Health Disparities Prevention is also the language access coordinator for the Department of Health. So we're responsible for all interpreting and translation needs and coordinating them throughout the department. And so we recently learned of a situation where there was a glitch with the technology and it changed the language when we had to translate it, and it changed it a little bit. And we heard about it. And we were like, oh my goodness, we can't have that out there. That's so disrespectful. So we moved really, really quickly to fix it, because when you are not respectful of somebody's language and that's part of their culture, you're not respectful of them. And so we needed to move very, very quickly to address it. And it may be a small thing to some of us, but it's a big thing when that's your language and that's your identity. So we need to be able to hear from our communities and understand and see what they're seeing through their lens, right? Because one of my favorite quotes is from Anais Nin. You don't see things as they are. We see things as we are, right? Because that's what the brain does. We fill in what's familiar and then we go from there. And so we have to be very mindful about that. What the pandemic has done, and I believe I've said this in other situations, is that it has brought the racial and health inequities to the forefront. Because as a woman of color, I knew all this was happening. I didn't need a pandemic to go, oh, there's a challenge in accessing services. Yeah, we knew this. And so how do we move forward to ensure that we're not wasting a crisis? And I don't mean to make light of it. We need to be able to continue to have that discussion and lean into the discomfort, because some folks may not want to do that. And you know what? The situation is the situation. So how do we best address it? And how do we best move forward? Because we need to. There's no going back. We can't go back from here. We just can't. And so we need to hear from those whom we serve. We are able to do that by providing language assistance. I think that's I really was looking forward to today's event, because I was so happy to be able to do this in Spanish. And that's why I asked the question, is it okay? And also too, for all the thought that went behind the programming. So that's one of the things. We need to be able to have individuals find a way to be heard and then to go from there. We're hearing a lot about some people not want to take the vaccine. They're never going to do it because of this, that, or the other. Okay, fine. Also, too, there has been historical trauma. However, right now we're talking access, because something, if it's available, that's great, but availability does not always equal access. So how can we get that to have more of a balance, right? And so this is where I think our responsibility lies. Because as Martin Luther King said, I believe, and I hope I'm not misquoting, if we remain silent to something, we're in agreement. So we can't remain silent. We need to be able to say something in some capacity. And in my role, we're not here to burn bridges, and we're not going to be able to solve everything. I'm not going to be able to solve everything, but what I can do is hear your concern and see who I can find to provide that support. I'll say it very quickly in Spanish, sorry. Entonces la pregunta fue si acerca de lo que se puede hacer acerca de las injusticias que se han visto, ¿verdad? Porque siempre han existido. Yo como una persona de color siempre he visto esto. Entonces para este pandémico no fue como que si encendieron un foco y ahora aquí vemos que hay injusticias, ¿verdad? Entonces, ¿qué es lo que se puede hacer? Entonces, mi respuesta es, tenemos que encontrar una manera que la voz del público se oiga. Por ejemplo, aquí tenemos un miembro de la asamblea, es una persona donde la comunidad le tiene mucha confianza. Entonces, hablar con esta persona que nos pueda ayudar, que pueda aumentar la voz, también presentar nuestras preocupaciones, porque ahorita sí es un pandémico donde estamos muchos sufriendo. Entonces es un crisis donde tenemos que tener esta oportunidad para manejarlo en una manera que esta situación no se vaya a cambiar, porque ahora no podemos regresar, no puede haber un retraso, tenemos que seguir adelante y nosotros tenemos también la responsabilidad de crear ese espacio para que las personas pongan sus preocupaciones, ¿verdad? Yo puse un ejemplo que había una situación donde nosotros somos responsables para la interpretación y la traducción de muchas cosas aquí en el Departamento de Salud, pero hay muchas personas, no solamente este departamento, hay muchas personas. Entonces encontramos algo que se vio que no estaba correcto en otro idioma. Entonces, eso también se puede parecer como falta de respeto. Si uno no respeta el idioma de la otra persona, también eso puede ser un malentendido que no estamos respetando la cultura de esa persona también. Entonces, nosotros trabajamos rapidito para reparar eso. Es un ejemplo muy chiquito, pero de cualquier manera es un ejemplo donde tenemos que reconocer que a veces cosas pasan y puede ser interpretado como falta de respeto a otra persona. Necesitamos encontrar una manera de incluir las personas para que las voces de ellos se puedan escuchar, porque así nosotros también aprendemos y podemos seguir adelante. Gracias. Thank you.
Great, thank you all. We're going to now transition to the Q&A. We have a lot of questions there that were received, some good questions out there. I'm going to turn it over to Jackie for the questions and panel. So let's rip. Let's go.
Yes, thank you to everyone for sending your questions in. The question function, the chat is on fire. So to make this a bit easier and make sure we can get through majority of the questions, I'm going to ask them and then turn it over to specific panelists. And if other panelists have anything to add to the answer provided by the specified panelists, feel free to do so. But I just want to make sure we're able to get through all of them. So the first one, I will start with Dr. Finlan. This is from Yelamar. It says, is it safe for nursing mothers to get this vaccine? Even if there hasn't been any direct studies on this, would you consider it relatively safe? Would it pass on some immunity to my child?
So it is considered safe. The American College of Obstetrics and Gynecology, as well as I believe it's the, Dr. Wilson, you can correct me if I'm wrong, but the American Society for Breastfeeding Medicine have both released statements saying that the vaccine should and can be offered to breastfeeding and or pregnant women as long as they are eligible. They certainly do put in the caveat that you would want to speak to your doctor and assess your individual risk given whatever you do for a living or kind of what your exposure is in your community, the level of prevalence in your community. But it is certainly considered safe. In terms of whether or not the immunity can be passed on to your child, that always is a hope we have. But like you said, there haven't been studies done on that. I will add that I am breastfeeding my kid. She's not an infant anymore, but I did get the vaccine, if that is helpful at all. Would you like the answer in Spanish too?
Yeah. Mm-hmm.
Entonces, la pregunta fue que si debo tomar la vacuna, si estoy dando de pecho, mamando a mi niño, y si es seguro para hacerlo. Y la respuesta es sí, está considerado seguro. Las sociedades de obstétrica y ginecólogo en los Estados Unidos y de lacteando, las sociedades de lacteando americano, creo que se traduzca así, han dicho que sí se debe ofrecer la vacuna a mujeres que están lacteando o que están embarazados, si son elegibles, pero si se desean hablar con sus doctores, sus médicos propios para evaluar su riesgo propio, cómo se puede contraer el COVID en su trabajo, en qué hace día por día, tal vez si es un nivel alto donde se vive, pero está considerado seguro. También había la pregunta si puedo pasar los anticuerpos a la bebé, y eso sí es una esperanza que tenemos. No hay estudios que han hecho, pero sí esperemos que usted lo pasará.
Thank you. I have another question, Dr. Wilson, if you could take this one on. It was said that Johnson & Johnson has a lower efficacy. What does that mean exactly?
So when you look at the studies that from their trials of whether it's Pfizer, Moderna, or Johnson & Johnson, what they're doing is they're tracking the decreased risk of developing moderate to severe disease or severe to critical disease. And so the rating for Johnson & Johnson, I think was about like 67% with severe, I think it was moderate to severe disease, one or the other. And then when you look at the other two vaccines, it was more up in the 90 percentile percentage for effectiveness. And so again, what that's saying is that the chances of this particular vaccine preventing serious disease from COVID-19.
Got it. If someone had, and Dr. Finlan, Dr. Wilson, feel free to jump in on this one. If someone had COVID or they found out that they have antibodies, should they still get the vaccine? If yes, what is your best argument to convince that person to still get the vaccine?
So if they currently have COVID and they are still in the infectious period, they should not go get the vaccine because they could infect everyone else that's getting the vaccine that day. That being said, if you are out of the infectious period, even if you have antibodies, it is recommended that you still get the vaccine. And the reason is, we kind of touched on it earlier, is that we just don't know how long that natural immunity lasts. The CDC does say that if you want to, you can delay it 90 days out, especially if you want to let people that are more at risk get it first. But it is recommended that people that had COVID do get the vaccine. Español. So la pregunta fue si ha tenido COVID y tiene, o si tiene anticuerpos, si debe tomar la vacuna. Y mi respuesta es, si usted tiene COVID y está en el tiempo infeccioso, no se debe ir a tomar la vacuna porque se puede infectar a toda la otra gente que está ahí tomando la vacuna. Pero si ya está fuera de ese tiempo de infectar a otra gente, o si tiene anticuerpo de una infección anteriormente, sí se debe tomar la vacuna. La razón es porque no sabemos cuánto tiempo dura esa inmunidad natural de la infección antes.
Great, thank you. If you get the vaccine, Dr. Wilson, I'll throw this one to you, can you still spread it to others if you are exposed?
So we do not know the answer to that question just yet. I will go off the premise, yes. And that is why we still need to take precautions of wearing our masks, social distancing, and good hygiene. And it's still very possible that you can get the vaccine and still come down with illness. And if you're demonstrating any of those symptoms that go along with COVID, you need to isolate yourself and be away from those so that you would not pass on the infection.
Thank you. And I think that's super important too. As Assembly Member Hyndman said, we recently saw a couple of members of the State Assembly who got a vaccine, who contracted COVID after getting the first dose of their vaccine. So as all of our health experts have mentioned earlier, we should still be helping to stop the spread by wearing our masks, washing hands, and trying to maintain social distance as well. I have another question. Is it recommended for an individual who has never had any vaccines, for example, the flu vaccine, to get the COVID-19 vaccine? And I'll open it up to whomever would like to answer that.
So Yes. Unless there's an
Yeah, I
allergy.
was wondering why would they have never have gotten the vaccine
Yes,
if there was a medical reason, like for the flu vaccine, if there was a medical reason for not, like an egg allergy or something?
Perhaps, yeah.
Right, yeah, you don't need to know more about that specific case, but if you've never had the flu vaccine, you can certainly get the COVID vaccine.
Okay. Is the vaccine safe for people who have had asthma or diabetes?
Absolutely. It's absolutely safe. And those are the pre-medical conditions that would qualify you to be higher up on the list to receive your vaccine.
Great. Sorry.
I would add that people with well-controlled asthma and well-controlled diabetes were part of the trial populations as well.
That's super important to know. Thank you for that. And then I have a question for you, Mrs. Alvarado-Little. How can we continue to have conversations with family members and friends, or are there any tips rather to having conversations with those who are extremely hesitant about getting the vaccine? Do you have any specific recommendations?
Okay, so this is where my clinical skills come in as an MSW. So first of all, it depends on where's that hesitancy coming from? So we have to meet the individual where they are. So where is that individual's hesitancy coming from? Because it may be human nature that the more you're told to do something, you don't, and the more you're told not to do something, you do, right? So understanding where is that hesitancy coming from, and then listening to that individual, not just hearing them. You really need to listen to find out what is that. And then, that's where the myth versus fact comes in, right? Oh, because I heard. Where'd you hear that? The other day, somebody said, well, I heard that it's made out of like fetal cells or something, I guess. And the person said, it's made out of this, and I know it's true. And I said, how do you know it's true? I said, I really like to learn how you know that's true, because I haven't come across any research that supports that. And then, what that did was it caused a little bit of a pause, and I read it on, something. So anyway, so not to belittle, and not, because this was me trying to understand this individual's perspective. And so if anything, I may not be aware of it. They may have walked away thinking, where did I hear that? How do I know it's true? Right? And so the next thing would be talking to or having them speak with somebody who is trusted in the community or in their world that also has that information. So that's where your healthcare providers come in, right? Because they're such a trusted source and also informed and have the information and can break it down. Like, so right now, both of the physicians have presented in a way that is a very health literate, right? I think if physicians, when they're together, would use different terminology than what is being shared here and much more clinical. And here it's been presented in a way that's very health literate. And so it opens the door to the discussion. And the other thing is that these conversations are not a one and done. There's several conversations when somebody does not agree, right? Those are several conversations. So to think that you're going to sway or change somebody's mind or make them do something in one sitting is not going to happen, because then the rest of it is not going to be helpful to them either. So understanding where they are, what is their basis for a certain type of thinking? What is the information that they're receiving and how? What is the hesitancy, the doubt, the concern? Is it something that maybe, they're just too shy to talk about? Maybe they're afraid of getting poked with the needle and have never told anybody. So, there could be a whole lot of things, and it could be something as you know, that they are firm in their belief that this is what's going to happen. So whenever we think that we're going to change someone's mind in one sitting, that's not going to happen. Very rarely, if ever. These are continued conversations with trusted members of not only our world and theirs, in order to provide that information. And at the end of the day, there may be some folks that are going to be completely resistant and not ever take the vaccine. And what I would say to those folks is, then you know what? Don't make up somebody else's mind based on what you're thinking, because we're having conversations to try to support and inform and not force, and that arrow should point both ways.
That's good. I agree with you wholeheartedly, fellow MSW. I will say too, I will say as well, you know, it's all about people's personal stories, history, and experience, particularly with COVID-19. I share my personal story. I have had a family member, a parent, pass directly from COVID-19. Actually, both my parents contracted it. My mom was a healthcare worker. She contracted it and gave it to my father. They both had it very badly. My father didn't make it. And there's still, despite that, is hesitancy within my immediate family about taking the vaccine. And at first I was floored that there was, and I had to step back and understand why. You know, there's people who have had direct experiences with this virus in ways that others have not, or have had, you know, like we talked about earlier, experiences with the healthcare system that have made them hesitant, rightfully so. So I think, to your point, Mrs. Alvarado-Little, it is always going to be a continued conversation. I will say my grandmother was one of those people. She's 90 years old and she was hesitant, but I was able to talk to her and she got both of her doses. So I think it's you got to be in it for the long game. And I just also want to create space for all of those on the call who have been directly impacted by COVID-19 or have had a family member or loved one or friends directly impacted by the virus. Our hearts and sympathies are with you. I'll open it up to you, Dr. Finlan or Dr. Wilson, if you have any closing remarks around conversations with loved ones, and then I'll turn it back to Yomika.
I agree with you 100%. I had a conversation with my sister-in-law, who is a teacher, and her and my brother were like, should we get this vaccine? At first I'm like, duh, yeah, I got it, and our other brother did. But it's meeting them where they're at. She's like, I have a lot of questions. And I said, go for it. I've got the time. Give me what you've heard, what you're concerned about, and let's address it. What are your fears? What are you worried about? And she's like, I heard this. Well, I'm going to show you facts that that's not true. I'm worried about this. Okay, let me give you this information. And by the end of our conversation, she's like, okay, I think I'm ready. I'm going to schedule an appointment. I think it's like in Syracuse, but I'm going to drive that hour to do it. And then she's like, do you mind talking to my friends? Because I think they have the same questions. Like, I got our conversation, but I can't repeat what you said to me to my friends. Would you be willing to have that conversation? And I think it's important meeting people where they're at, you know, and it's a personal choice. And I believe in informed consent. So therefore, I'm going to give you the information I have. And then it's up to you to make the decision what's best for you and your family.
That's such a good point. Such a good point. Dr. Finlan?
Yeah, I am also in conversations with one of my sisters. I have not gotten to the point Dr. Wilson has gotten, but you know, every time we talk, there's just another hesitancy or another reason. It's just trying to answer. And sometimes it's something simple, like, I'm worried, like, are you getting this vaccine? I'm worried you're going to get frostbite from the Pfizer vaccine because you know, it's stored at deeply cold at cold temperatures. And it's, you know, explaining, well, you know, there's actually a process where it kind of thaws out and everything, and things that I would have never personally kind of crossed my mind, but just kind of being open to hearing what the concern is, you know. So I agree with everything Dr. Wilson says, and it isn't like Ms. Alvarado-Little said, it is not a one-time conversation. So every time we talk, there's a little bit more broken down, a little bit more questions answered, and hopefully one day, but it is an individual decision.
Great. I want to also give, there's actually one more question in the chat, and I want to ask it. It's in Spanish. si uno tiene alergia a varias cosas, uno se puede vacunar. Can somebody answer that, please?
I'll answer. Si uno tiene alergia a varias cosas, uno se puede vacunar, es la pregunta. Y si usted tiene alergia a uno de los ingredientes en la vacuna, no se debe vacunar con esa vacuna. Entonces, tiene que evaluar cuáles son sus alergias y ver si tiene alergia a uno de los ingredientes. Si tiene alergia a nueces, almendras, algo así, o penicilina, sí se puede tomar las vacunas. Dependiendo en la alergia, cada persona que tome la vacuna tiene que quedar para 15 minutos después para monitorar. Dependiendo en la alergia, tal vez tendrás que quedarse para 30 minutos más, pero eso será la única cosa.
Thank you. And thank you for translating my Spanish. I appreciate that. And I want to give a big shout out to Tess Levin on the call, who is a teacher at Achievement First Endeavor Elementary, who is helping me to manage the questions on the back end and also putting in some amazing resources. All of the resources that have been shared in the chat function will also be made available on the Achievement First Resource Hub. Tess, if you can throw it in the chat. So all of these by the end of the week, for sure, some of them we just got today, but they will all be added to that Resource Hub. So you can bookmark that and check it periodically because all of the resources will live there. I am going to turn it over to Yomika, who is going to close us out. Thank you so much to our wonderful guests and for everyone who participated by providing such great questions.
Well, this has been phenomenal. I want to start by saying thank you again to our panelists. And I want to give Tess a shout out too, and I'm going to give Jackie the shout out because I know she won't do it for herself. It's been an amazing panel, amazing. The second time around, and I've learned even more this time, I think, than I did the first. So this keeps getting better. And I remind everybody that this has been recorded, and we will be providing the links, and you'll either get that through email for everyone who registered and provided that information. Before we close out, I also want to say very, very special thank you to Alicia Hyndman. I know that you're doing this right as you're resting up and as well as in the middle of budget negotiations. So thank you for taking the time to come out via Zoom and open it up and share remarks with us. And then for everyone who's in attendance, I want to share the polls. So we did take a poll. I want to share the results of the first poll, and you see that right now. So have you received the vaccine? 29% said yes, about 30% of our attendees, right? 71% still have not. Do you plan? 68%. 32% say that they do not plan to get the vaccine. And we're about half on do you need more information on that. So I'm going to see if we can put up quickly, if folks will give us another second, another poll to see how we ended up. So that's where we started. I want to send another poll up to see how we ended. And if you'll give me a second to make sure I have my technological skills down pat. Hold on one second. Let's see if I can do this. I wish I could sing because I would do that while I'm fiddling with this.
Make some elevator music.
That's right. Nope. Well, I'll try it again. And this is on your final thoughts. So, let's see. Well, we may have a mission fail on this one. I can't get the second poll to come up. Well, Zoom, thank you very much. First, it was Google with the translations at the bottom. Now, now it's this. Let's see. Nope, user error. Here we go. We're launching the poll.
Yeah.
Oh, yay.
That was good.
Thank you for your patience. And for everyone who's on Zoom and who worries about getting it right, I don't do that anymore. I just talk. We're going to work it out. We're going to make it happen as we go. So thank you for bearing with me while I launch that poll. We have our results coming in. Let's see. I do apologize. We do not have the poll available in Spanish. But if I could ask, as I said, I'm just going to go on the fly, and so if I could ask someone to read it in Spanish, and maybe people can just respond in chat.
The first question, la primera pregunta, después de esta presentación, ¿piensas que sabes más sobre la vacuna? ¿Sí o no? La segunda pregunta, si usted necesitaba más información antes de tomar la vacuna, esta presentación le ayudó a tomar una decisión. Sí, estoy planeando tomar la vacuna. No, todavía no planeo en tomar la vacuna. Y la tercera sí es que no sé todavía. Y la tercera pregunta, si esta presentación le ayuda, si esta presentación le dio información que usted tiene confianza, en que usted tiene confianza. ¿Sí o no?
All right, we're going to give it a, let's see, so we're going to end the poll in a few minutes, few seconds here. And Jackie, I'll just ask you, if you want to read the results of the poll?
Yeah. Okay, so after tonight's forum, do you feel like you know more about the vaccine? 95% said yes. 5% said no. If you needed more information before getting the vaccine, did this form help you make a decision? 47% said yes, they plan to get the vaccine. 32 said they're still on the fence, they're still unsure. And 21% said they do not plan to get the vaccine. And then, was this form helpful to provide information you trust? And 100% of respondents said yes.
So thank you all. Thank you, panelists, again. Thank you for the folks who are attended tonight. Please share this information. Please share the links, all of the links, the information that was in the chat. If you need any additional information, please don't hesitate to reach out to us. Thank you again. Be safe. Enjoy. Have a good night. Thank you.
Good night. Be safe.
Thank you.